just wanted to say welcome again to the city and the county, and thank you for taking on this task as the medical director and health authority of the city of Austin and for Travis County. I think it's been 2 months or so, a little over 2 months.
Almost 2 months.
Almost 2 months. Well, it's
Yes.
been wonderful working with you. And before that, it was also wonderful working with you in your post with Bastrop County on all of our group vaccination efforts.
Thank you.
So I was hoping that today, if you could just give us a little bit of perspective on what's happening with COVID. We're obviously seeing a lot of things in the news, and it looks like we're headed for frankly, worse things with COVID in Austin and Travis County. And just, would you mind sharing a little bit about what's different or new with COVID-19 in the county right now?
Sure. Thank you. Thank you, everyone. Good evening. I came to this job and we were in the county not experiencing a lot of new cases. We were, at that time, we had an average of 11 hospital admissions per day on the 7-day moving average. And today, unfortunately, we're up to 35 on our 7-day moving average for hospital admissions. And we've had 302 new cases reported to us today. Our average case, new cases in the past was on a 7-day moving average was 30, and we're now up to 148. So what's happened? In the latter part of April, we started hearing about something called the Delta variant, and viruses change the way they evade our ways of treating them and our vaccines. And that happens when they're allowed to grow in people that are not vaccinated, and they become more clever. And that's what a variant is, in a sense. So since April, we've gone to negligible amounts of that in our community to that variant by CDC data tracking and other sequencing data, making up about 87% of what we're seeing in the cases that we have. And we've had some confirmed cases in our community. The sequencing itself is something that's not done routinely. Typically, we do PCR tests, the swab in the nose that nobody likes, to diagnose whether or not we have COVID. And the treatment for COVID is essentially the same, with the exception of maybe the tweaking of a different new product regarding the monoclonal antibodies that we use. But the supportive care and the things that we do for people that have COVID is pretty ubiquitous as far as that goes. So it's getting diagnosed and testing people and identifying who has it and getting them to self-isolate at home and using their own room and their own bathroom. Those are the key factors to keeping this from spreading. And then in late December, early January, we started rolling out vaccinations, and our vaccines are also helping to curb the spread of this disease and are still key elements to our ability to fight this pandemic. But last week, in addition to knowing that we masked and social distance, which everybody probably dreams that phrase, wash your hands, wear your mask, social distance. We did we took a look at what the modeling and the projections would be if we took what we were seeing at that point in time as far as our case numbers rising. And the UT Modeling Consortium, which we're so blessed to have in our midst, produced a report that showed that we were showing surge or increases in cases that are not only related to the fact that we have people who are unvaccinated, but there's some evidence to suggest that there's some people that may have been vaccinated who are having a mild disease that's not requiring them to be in the hospital. So because of that, and because those folks that may have mild disease, maybe walking around without a mask, we're going to ask folks who are vaccinated to wear a mask just in case they have it and they have mild symptoms and may think it's the allergies, or they may not have symptoms. But that's the reason for the change that we're going to be asking people to make. And then we're going to ask, as always, that people that are unvaccinated or not fully vaccinated because they only got that first shot and they haven't gotten the second one yet, we're going to ask them as well to wear a mask. So, you know, we know that this is happening. We've seen that our legislators who've bravely gone to fight for voting rights are starting to have problems with COVID as well, and they're vaccinated. And there are other people in the community who've had that issue as well. We think that our community is ready to hear this message and to work together again to get our numbers down. And the modeling data shows that if we do this thing, that we have the chance of reducing the numbers of cases and ultimately doing what we said we wanted to do in the past, which is flatten the curve and take the strain off our hospital system. So that in a nutshell, hopefully not too long of a speech, is what we're talking about doing.
No, thanks. We were talking just before getting started here with Representative Goodwin and Representative Howard that we're getting a lot of outreach from parents of young children that still can't get vaccinated but are set to go back to school, just like my daughter is set to go to school this fall, or next month, I guess, the middle of August, August 17th, I think. And, you know, short of getting into more legal battles with the governor, what advice do you have for parents of kids that are going back to the public schools or schools in general this in a month?
I fall in alignment with the American Academy of Pediatrics, and when they say that our children who are going to be indoors should wear masks if they're 2 years of age or older. That's just, you know, the smart thing to do. It protects them from being exposed to those infected particles in the air and getting COVID. So that would be my recommendation, sir.
That makes sense. Thanks. And so sounds like get vaccinated, bring your family and friends to get vaccinated if they're not yet. Wear your mask if you're going somewhere and you're indoors, and then obviously for kids going back to school, wear masks as well. Is that a good takeaway from this?
Yeah.
Awesome.
Yeah.
Well, thank you very much, Dr. Wilkes. Thanks for all you're doing, and I'm sure I may end up talking to you later tonight about other things with the mayor and the doctors of what it is we're going to try to do over the next few weeks. But thank you so much for the long hours you're putting into this and all the hard work that you're putting into this. Thank you.
You're welcome. I do want to add, though, that if people are in crowded situations, indoors or outdoors, that extra layer of protection with masking is a good idea too. So,
absolutely.
Yeah.
And that makes sense.
Thank you.
Yeah.
Thanks for the opportunity.
All right. So up next, I think we've got my wonderful Chief of Staff, Kate Garza, who's going to talk about some of our volunteers and the great work that they've been doing for us. Take it away, Kate.
All right. Thank you, Judge. Mal, can you put up the graphic we've got? And I'm going to go ahead and keep us moving on time. All right. Good evening. Thank you all to everyone joining us tonight. My name is Kate Garza, and I am the Chief of Staff for Judge Brown. They gave Dr. Wilkes the hard job. I get the pleasure of sharing some good news. Although we are seeing our COVID positive numbers trending up, and we still have a lot of work to do, it's important to reflect and acknowledge how much we have already accomplished together. And as many of you know, and actually many of you have helped contribute to our efforts, we started the first mass drive-through vaccine effort in the state of Texas here in Travis County in January. And in late February, when the state told us that they would provide us with thousands of vaccines that we could focus on our hardest hit communities, if only we could build a large-scale vaccine effort. Of course, we said yes, and then we turned to all of you and said, can you please help? And in total, our county collaborative helped bring in over 200,000 vaccines, and those are vaccines that are in addition to what was already coming in through the Austin Public Health and through the private sector. And we partnered with our collaborative partners, Community Care, Ascension, Seton, Bastrop, Caldwell, Hayes counties, our constables, our emergency service districts. But we also leaned really heavily on individual members of our community to pitch in and help out. And in total, nearly 10,000 folks signed up to help on our volunteer list, on our Travis County Volunteer Corps, and 3,000 people volunteered at least one mass drive-through vaccine clinic sponsored by Travis County. 320 people volunteered at 4 or more of our vaccine clinics. That's just phenomenal. In total, we logged over 42,000 volunteer hours for the county at the clinics, and that's a value of about $650,000 to Travis County. And most importantly, thousands and thousands of people's and families' lives were changed as a result of this effort. So we just want to say thank you to everybody that helped do that. Next Tuesday at Travis County Commissioners Court, Judge Brown is sponsoring a proclamation in partnership with the rest of the court to recognize the 320 people who volunteered at 4 or more of our clinics. And we'll be saying thank you to all of our community partners. So with that, Judge, I'm turning it back to you.
Awesome. Thanks, Kate. So now we'll move on to talk with Constable George Morales and Chief Bailey, who, if y'all tune in on Tuesdays, you've probably seen them give their updates periodically as to what they're working on. But just want to say thanks to both of y'all for everything you've done since January and before in planning to help vaccinate our community. Back in, I think, February, March, April, we saw a lot of success hosting the large COVID vaccine drive-through sites, Circuit of the Americas and other places. We've since pivoted to different styles of vaccination, and I just want to talk a little bit with the chief and the constable about what that looks like. So Chief Bailey, would you mind just taking a moment to describe what the efforts look like now for getting people vaccinated?
Good afternoon. Thanks for having us, Judge. And just to plug what Kate was saying earlier, the efforts that we started with in the mass vaccine effort would not have been possible had it not been with the volunteer support that we had. But as mentioned, we started with a mass vaccination process with the idea that if you build it, people will come. As we continued to watch the data and that was no longer needed, we started to identify areas within the county, primarily on the Eastern Crescent, where people didn't have as much access as we would like them to the vaccine. And so Constable Morales, myself, and Seton and Travis County and APH and a number of other players that came together and started to do pop-up clinics. And our goal was to remove all of the obstacles and make it easy. So we started with going to local grocery stores. And then we expanded the hours to that so that we would catch people coming home. Some of these are essential workers, and we would capture them after work and try to make that available. To date, our Travis County effort, including the mass vaccination, has vaccinated a little over 100,000 people.
Thanks. And Constable Morales, would you mind commenting a little bit on what you're doing and the team is doing to reach out to the most vulnerable communities in Travis County with these efforts?
Absolutely, Judge. So I think the effort, Chief Bailey said a lot of it. The effort is to make it easy and accessible to our communities, taking shots into the communities for working families. Those are the most vulnerable. Those zip codes that were highly affected by COVID. That was the main goal. As we continue to get out there and push our pop-ups in our clinics and our grocery stores, we want to just encourage everybody to continue to push that message, because the more we can get vaccinated out there, I mean, we don't throw a whole bunch of clinics up just to throw them up. We'd like to see participation. And right now, I think with the help of everybody that Chief Bailey mentioned, we're getting there. You know, we just got to continue to push forward. But as we continue to push forward in these vulnerable communities and these communities that have been highly impacted by COVID, we want to make sure that it's easy accessible, not because of lack of technology, lack of transportation, and also make it safe for people that are out there getting the shot. And we try to make them feel comfortable for that.
Thanks so much. Yeah, well, thanks both of y'all for everything that you've been doing and you're still doing, and look forward to working together more. And also just want to give another shout out to our partners, Community Care, Ascension Seton, Dr. Hockaday and her clinics, Maynard Mayor, Larry Wallace, Karen Smith. So many people have really thrown in on this, Chuck as well with the county and the whole county staff as well for helping put it all together. So thanks y'all. All right, so now for the final piece of our town hall, and then we'll of course go to questions at the end. We've got some of the Travis County delegation that represents us in the legislature here today with us. Their Texas House Democratic colleagues and some of the Senate colleagues also broke quorum in the face of a special session with an array of bills that really would have harmed our community, from voter suppression bills to bad bail bills, bail reform bills, anti-trans bills, anti-abortion access bills, critical race theory bills, and so much more. So I'm really excited to be joined tonight by the majority of our delegation, including Senator Eckhart, Representatives Donna Howard, Celia Israel, Cheryl Cole, and Vicki Goodwin. And then also just wanted to say thanks to Representative Rodriguez and Representative Hinojosa, who could not join us today, but we're really thankful that they're up there fighting for us as well. So why don't we just, if y'all don't mind, go around and check in and see how everybody's doing. We could start with, let's see, I see, there you go, Donna Howard. Why don't you just start and give us a little bit about how you're doing and what it's like up there in DC.
Well, thank you, Judge, for having us be a part of this. It's good to have an opportunity to check in with our constituencies, which of course overlap with yours. And so glad to have this time to visit. There's probably lots to talk about here, but you know, obviously we came here because we felt that there were no other options in terms of trying to prevent a legislation from being passed that would significantly impact the ability of many of our constituencies to be able to access their constitutional right to vote. And without a vote, you don't have a voice, and without your voice, you don't have any power over what happens to you. And this is all about self-governance. That's what this country was founded on, and that's what this is about. We did not do this lightly. And there are a lot, as you mentioned, Judge, there's a lot of things on the agenda that we're not happy about. We would not like to see passed. But what rises to the occasion here that puts us in this extreme position is the very foundation of our democracy, and that's the right to vote. So we had no other options we found other than to break quorum, and that is within the rules of the House that are voted on by both Democrats and Republicans. So we were following the rules of the House and chose to use that particular rule to deny quorum. So we are here. I think at this point we have 56 of us that are not part of being in Austin at the moment, and there needs to be 100 total. So right now I think they have 91, if my colleagues can correct me on that. So still short of the quorum, and we're very committed to holding out here to assure that that quorum is not present. We've been working nonstop here in Washington, visiting with our congressional leadership, pushing for federal legislation which would ensure some national standards, a minimum floor, if you will. And what we're really wanting here in Texas is pre-clearance. That's, you know, regardless of all the other aspects of the bills, pre-clearance is really important to ensure that we do not have discriminatory practices which do still continue, unfortunately, in our state. So there's lots more I could talk about. That's just kind of a foundational place to start. And I know that all my other colleagues are here to talk, so I'll stop there and then we can continue in whatever way you want, Judge.
Awesome, thanks. Senator, what are you seeing from your perspective? What's it look like over the next couple of weeks? What are we fighting to do?
Well, you know, first, I'm so sorry that I missed Dr. Walk's presentation. Mostly I'm concerned certainly we're concerned about what's going on with this elections bill, but because of the incredible heroism of the House, it's a dead bill right now. And I implore everyone, I know that everyone on this call most likely has been vaccinated, but really getting everybody out and get them vaccinated as quickly as possible, because we are in a hockey stick shaped spike in COVID cases. So that's what I'm seeing locally. In terms of the thankfully currently dead bill, it's a zombie bill and it's coming back. And that zombie is going to march all over the place, but we're going to push it, push it, push it. I have read and reread and reread and tabbed the hell out of the bill. I can find not a single instance of actually increasing the probabilities of someone voting in this bill. There are two ways to influence an election, as we all know. One is to scare away the people who are going to vote against you. And the other is to encourage those to show up who are going to vote for you. I can see nothing in this bill that is anything but scaring people away from the polls, confusing them, scaring them, intimidating them, gotchas on vote by mail. There's absolutely nothing in this bill that encourages people to come out and vote. It's a very bad bill. But even if they pass the darn thing, we're still going to come out and vote in historic numbers.
Thanks, Senator. Representative Israel, how do you see it?
Hey, Judge. This is a really historic thing that we're doing, and we'll never see this again. We've only used this tool, legislative tool, 5 times in Texas history. We will never see this used again when we believed that it was time for us not only to break quorum, but to take our fight to Washington, where there's a very narrow window for us to get something done. That juxtaposition of time between state government, when we've been put in a so-called emergency session, and the federal government, with so many unique things, where we just celebrated the life of John Lewis, and on August the 6th, we will celebrate the anniversary of LBJ signing the Voting Rights Act. We're putting ourselves in that space to say that it was worth it for us to kill this bill during this special session, make a case to Congress and tell them our story. We feel very strongly about that, and we're very unified. We got here July the 12th, and we are not going back until August the 7th.
Right on. Thanks. Representative Goodwin, how do you see it?
Yeah, thank you, Judge Brown. So this is day 11, and it's been it's honestly been a lot of stress on a lot of the members, but we've had a lot of conversations about how committed we all are to staying here until August 7th to make sure that we do kill the bill, at least during this session, and that buys time for Congress to do something. One of the most impactful speakers that we heard from yesterday was Crystal Mason, who tried to vote. She was on probation or parole, I can't remember which, but submitted a provisional ballot, and then they came to arrest her, charging her for criminal conduct when all she was trying to do was vote. And she said to us on that call, I just want it to be fair. You know, she said, how can it be criminal to go and vote? And her vote didn't even count. So how in the world can we be putting a woman in jail for trying to vote, that vote being rejected, and she didn't know, she didn't realize, no one had told her that she couldn't vote. So, you know, the argument that the other side is trying to use is that we need to fix our elections. We need to make them secure so that we can't have fraud. Well, the thing is, our election law already allows for free and fair elections, and they're secure. And we've had the Secretary of State tell us that they were secure. We actually had a conversation with 5 other secretaries of states from around the country, and that was really interesting as well. Every state handles their elections differently, and so that alone makes it confusing. If you're someone who's moved from another state to Texas, you may not know that you have to register so many days before an election. We should have automatic voter registration, online, automatic, and on the same day. And if we're not making it easier, then we are making it harder. The Republicans keep trying to say that this bill makes it easier to vote, and that's just baloney. So we're working hard to kill that bill and get Congress to pass something here.
Thank you. I am noticing it looks like y'all are all in the same style of hotel room from the backgrounds. Representative Cole, I think you're muted right now, but tell us a little bit about what it's like up there and what you've been doing.
Well, we've been meeting with senators on the Hill. I got to meet with Cory Booker. Boy, is he cute. And they've all been real encouraging in their conversations and real hopeful. The people who met with Senator Manchin said that he's interested in passing the John Lewis Act, or a portion of that act that would deal with Section 5 of preclearance, which would make it where we would have to have Justice Department approval of any change in election law that affected a minority group. So that would be good, because that's essentially what Texas needs. And then we've been having conference meetings every morning with an educational national group that's educating us about voting rights. And so that's been good. So we've been meeting with senators and going to conference meetings and just trying to stay out the media.
Yeah. And maybe back to Senator Eckhart for this first, but what would the For the People Act do for us in Texas? And any thoughts on that actually happening, I guess?
Sure. The For the People's Act is this wonderful, wonderful document that has all of the best practices with regard to voter expansion, including online registration and so many other things. And it also includes many provisions that regard redistricting as well, and making the process around redistricting a truly fair process. And I want to, give a huge shout out to Representative Howard, who had a wonderful bill in plenty of time for us to adopt best practices with regard to redistricting. And did the current leadership even give that bill a hearing in the 2019 session? I don't believe did they even give it a hearing? Got a hearing, okay. So the For the People Act is this wonderful piece of legislation if it were passed. When we did meet with Senator Manchin was candid in saying that the likelihood of the For the People Act succeeding was low, and that he would not be in favor of utilizing filibuster for a bill that was that broad, and that he left open the possibility of utilizing some version of filibuster for a bill that was pared down just to voter access alone. And so that's where we were in our conversations with Senator Manchin, and I think that was corroborated in some subsequent conversations with him.
Okay. Well, I'm looking through the chat. There's a lot of people just saying thanks to y'all and asking how folks here can help y'all. I'm guessing there's some links to donate we'll put in there too, but Representative Howard, what do you think? How can people help, and how do we get something passed at the federal level? Do you think that's possible?
Well, I think I would love to be more hopeful. Certainly, we've heard a variety of things that give us some hope that something could be done. I think the real bottom line here, though, is that we're hearing that it's going to be unlikely to get what we really would like to see. That being said, I think our presence has generated more discussion about, so what could we actually get accomplished, with more talk about what could we do. In fact, several of the senators talked to us about, especially with Senator Manchin, asking him to say, okay, what would you pass if you could? Let's start from there. And Senator Klobuchar in particular talked about the fact that it was like 70% of what was in the bill he actually came up with. So there are instances of common ground there. The big issue is really the procedural one of whether or not you can pass this without getting rid of the filibuster and without getting into the weeds. And certainly I'm more focused on what we do at the House here in Texas than I am with what happens in DC. But the fact is that these things like the 2/3 vote that Senator Eckhart had at one time in the Senate and that the filibuster provides in Congress is supposed to prevent the majority from being able to totally run over the minority. And that's good. That's good to have that. But what happens is that if you use it for everything, you prevent any movement from happening. And so with the filibuster at the congressional level, there's already carve-outs to have Supreme Court appointments. And it's being proposed that perhaps this would be justification for also having a carve-out when you're talking about democracy, when you're talking about voting rights, that might be a legitimate carve-out to the filibuster. So things like that are being talked about. Whether or not anything's going to happen before they recess on August 6th, of course, remains to be seen. There's a lot of things in the way, if you will, like the infrastructure bill and the budget and those kinds of things. So, I think that there's still the possibility, and we're going to hang on to that. And I don't know, what else do y'all have to say? I mean, Celia, I see you're chomping to say something.
The thing that we're not used to is making history as a herd of cats. And that's what we're doing. It was, as they say, Democrats are not an organized party, but we figured out a way for all of us to leave town and shake things up and get national media attention on a situation it's a national issue. Too often we have seen very harmful legislation that is a cut and paste from a very fringe organization that is then doled out like candy around the country. And Texans were expected to take the same harmful legislation that passed in Georgia, and we were expected to take our licks, do what we normally do, make good arguments, try to make amendments, but it was obvious what was going to happen. This was Governor Abbott doing a special session at the bidding of Donald Trump. And y'all who know me, I don't like to go there in that harsh or partisan way, but our country is at a seminal moment. And we decided as Democrats, we needed to make a stand and fight for what we thought was right. And this is what we're doing. So we are in the minority. We've been in the minority for over a generation. We know how to fight. And the best way that we could fight is take our case to Washington. And there is a lot happening right now. And you guys need to all help us if you believe in what we're doing. Help us make some noise back in Texas. And I know Dr. Barber is planning a march next week from Georgetown to Austin. Join him, join the movement, and watch for activities leading up to August the 6th around the Voting Rights Act. This is our fight. We're fighting with the only tool that we had. Each one of you on this call has the ability to help us sound the alarm. This is not just the Democratic House members' fight. This is the fight of our country. And for many of us, it's the fight of our legislative careers.
Thank you. I see a question from Jeff Jack. Actually, I hadn't thought about it this way. It's interesting. Do we have any sense of how many, if this bill at the state level passes, how many people would be disenfranchised? Are there estimates on, I don't know if y'all have any thoughts on that, Representative Goodwin or anyone else want to take that?
No, but we do know that over 100,000 people use the drive-through and 24-hour voting. So it was heavily used. If we take those types of things away, if they have poll watchers that are intimidating people, there's all sorts of ways that people will be discouraged, just like Crystal Mason was discouraged. You know, when you make people feel like it's not worth it to go vote, it's really hard to count how many people that might be.
Yeah, that's a good point. Representative Cole, any thoughts on that?
Well, we know that we had a 24-hour hearing through the House Select Committee of Constitutional whatever, and the Republicans didn't take a single amendment from the Democrats. So they've shown an absolute resistance to allowing anyone to vote. All I know is that we have 29 million people in Texas, and I wouldn't want to venture a guess of how many that would impact. But like Vicki said, just all this aura surrounding difficulty to vote with poll watchers and not being able to drive through voting or early voting, we can only guess at the impact that will have, even from people just hearing about it and the criminal penalties.
Yeah, absolutely. Well, Representative Israel, thanks for mentioning that march next week. Where can people go to get more details about that? Do y'all know? Do y'all have anything else on that, or is it just kind of coming?
It's coming together, Judge, with all of our allies, Move Texas, and so many other, coalition of organizations are working together. This would not have happened were it not for us breaking quorum. There's something happening in Texas. We are awakening a new struggle, and I can't stress enough how much this is a unique opportunity that we need to work on collectively. There's a space for everybody to be a part of this fight, and it's a big, serious fight. The same people that it is when we went to Capitol Hill, it was chilling to see the place where the January 6th insurrection happened. Those same people who refuse to acknowledge in the safe transfer of power and the legitimacy of our elections very much want these harmful pieces of legislation to pass. It's not a good thing for any of us.
Yeah.
May I interrupt, Judge, too? I was trying to look right here through I've got bunches of little papers here with all my notes I've been taking, and I can't find the numbers that I'm looking for right now, of course. And I think part of the challenge is, we're still a low turnout state. It's hard to come up with what the numbers are that would be disenfranchised, because we're at a point where we want to encourage people to vote, and it's hard to get our heads around what it would mean. But we're right now at the figure I've been given, we're 44th in the nation in terms of voter turnout. So it's not like we don't have room to grow. And when we saw what happened during the pandemic, and especially with Harris County and their innovative ways of trying to address shift workers, and I'm a nurse. I know a lot of the nurses work double shifts. And Andy, you got a wife that's a nurse. You know what this is like. People have shift work. They don't have the normal hours to vote. And having 24-hour voting and drive-through voting and options that allowed for the flexibility significantly increased their turnout in Houston. And in fact, 60% of those that used the drive-through were women. And one can assume that a lot of those women had children. And you're able to actually get to the polls and drive through without having to unload a parcel of kids and then go stand in a long line in order to vote. We're talking about making it easier for Americans to exercise their constitutional right. There were no instances of improprieties or fraud connected with the drive-throughs and the early voting and the extended hours. All it did was ensure that shift workers and parents and those who may have disabilities had more options to actually get their vote counted. And that's all we're talking about here. And, you know, Senator Eckhart talked about, you know, looking through the bill and not seeing that's really expanding anything here. And basically it's not. There's some small segment of the population between 55,000 and 100,000 counties who might have an additional hour, you know, something like that. But bottom line is, right now there's no prohibition on 24 hours. This legislation doesn't allow that. It restricts between 6 a.m. and 10 p.m., a 16-hour period with a minimum of 12 hours. So it's actually providing less options. It's not allowing for drive-through. And I know somebody in the chat said something about the poll watchers. That's one of the most egregious parts of this, to think that, I think Celia was mentioning that a while ago, to think that people can come in basically unfettered to intimidate people when they're trying to vote. And not only that, but this bill has a provision that says that the election official has to observe that poll watcher doing something that's not allowed. You can't, if you're the voter and you're saying, hey, this guy is hanging over my shoulder, that doesn't count. You have to have been observed by the election official. You have to get a warning. You can violate this once, and then you get another time to do it again. It's just egregious. And it also puts our retirees who work at the polls in the position of being subjected to more prosecution against what they do to stop the poll workers. So, you know, it's really, if we really wanted to increase people's participation, this is not the way to do it. This is intimidation and coercion, and it is kind of the mantra of our governor, unfortunately, right now, with his vetoing the legislative branch of government and all the other things he's doing, threatening to arrest us, that are based on a behaviors of bullying and intimidation. And the voting bill is exactly that same kind of effort to intimidate voters and prevent turnout.
Wow. Yeah. Thank you, Representative Howard. Well, thanks all so much for being part of this. Senator Eckhart, I'll let you have the last word. Before that, I see that Pooja put a link in there for people that want to join the march next week in the chat. But Senator, you want to take us out?
I don't think, frankly, I really think it's the House members who deserve the last word. The House members are making this incredible sacrifice. So I want to say one thing and then leave it to you all, because y'all are rock stars. And I so appreciate you. I do want to just chime in on what Donna was saying. This idea that there is an expansion of the number of hours under this bill is a lie. I want to be real plain about that. That's a lie. Current election administrators can increase their numbers of hours under current law. So that's just a lie. And the poll worker provisions are dastardly in the extreme. There are no consequences for poll workers except to be removed from the polls. There are criminal penalties that carry jail time for election workers who curtail poll watchers' activities. That is just dastardly. So with that, I'm going to stop talking, because I'm down here fighting in Texas while our incredibly brave House members are up in DC, away from their families, their homes, their friends, their businesses. And I deeply, deeply appreciate what you're doing.
Thanks. Representative Goodwin, any last words?
I did want to say we had a conversation with Beto today, and I asked him if he would help us with a rally that several of us have been talking about on August 6th or 7th. August 6th would be the anniversary of the voting rights passage. August 7th would be our last day of special session. We want to make it a across the country type rally, and Beto said he is willing to help us out with that. So be looking for information to come on that as well.
Awesome. Thank you. All right, Representative Cole, anything final before we go?
I just want to thank you for all the support that you're giving, Andy, and putting this together and putting us on. I've received tremendous support from my district and only complaints out of district. So I just want to thank you for putting this town hall together and everybody in Travis County being so supportive.
Thanks. Well, thank you all. I think the chat agrees. Y'all are all rock stars. So thank you so much for everything that you're doing for us, and keep it up and let us know how we can help. Okay, so let's see. I think we've gotten through a lot of the questions. Well, Mal, if you want to check and see if there are any other good ones in there. And let me just give a couple updates about what's coming up in the next week. So on Tuesday, we're going to recognize some of the volunteers from the COVID vaccine clinics, the over 3,000 people that helped us through the vaccine efforts. School obviously starting soon. We talked a little bit about that earlier. AISD starts August 17th, Del Valley and Eanes on the 18th of August, Lake Travis on August 19th, Manor ISD on August 23rd. And a lot of kids are going to be going there who are not vaccinated because they're under 12 years old and can't get vaccinated. And I look forward to working with everybody on ways to make sure that our kids are safe and masked. August 18th is when the budget hearings will start at the county, and we'll post some more updates when we get closer to that date. Let's see, where are we? Well, Mal, do you have any other thoughts for us? We've got.
There are a ton of questions that have been asked, but since we don't have all of the time in the world, I'm going to ask you a couple of the important ones. And if you are one of the panelists and you have answers, please feel free to come off mute and respond. The first one comes from our Facebook live chat, and it's, are there still vaccination clinics?
Yes, there are. I'll take a stab at it, and then I don't know if Constable Morales wants to mention it too, but Expo Center on the weekends, during the week, Constable Morales and Chief Bailey are doing them at grocery stores around, especially in the Eastern Crescent, schools, other places. If you go to traviscountytx.gov, there's a list of all the places that Travis County is doing. Austin Public Health and other groups are also putting together vaccination efforts that they list on the Austin Public Health website. But if anyone else on there wants to comment on that.
That's perfect, Judge. We just want to also make sure that we check in with their local AISDs in your area. Also, we'll be doing shots at the schools.
Awesome. Thank you. And yeah, we're all hoping for the FDA will let us vaccinate kids under 12 at some point soon, I hope, but we're not there yet. Mal, I think maybe one or two more if you got them.
Another question, and this one maybe is the most relevant for Dr. Walks. We have a question from Ali from patients hospitalized. How many were fully or partially vaccinated?
From our limited data that we have now, we're in the process of evaluating that situation. It appears as though we're looking at somewhere around 7 to 8% of folks who are in hospital are vaccinated. But the large majority of the people that are in the hospital, almost all the people in the hospital are unvaccinated. So this still is a pandemic of the unvaccinated, as Dr. Walensky has said, our CDC director.
Thank you, Dr. Waltz. And I see LSE put in the chat a link to on July 24th from 10 a.m. to 2 p.m. at the Hong Kong Supermarket on 8557 Research. Looks like the Travis County Mobile Collaborative, Constable Morales and Chief Bailey and Ascension Seton and others will be giving out the Pfizer vaccine. That's July 24th from 10 to 2. I think that's in the chat.
And then another question in the chat, just to make sure folks are clear, Doctor, if you also want to touch base a little bit on if we're moved into stage 4. I think people just wanted a little bit of clarity as to which stage we're in and just more info on that.
Oh, I think you're muted, Dr. Wall.
Okay. We are for all intents and purposes, moving into stage 4. We've been, as historically we've done in the past, we usually take a few days to make sure that the trend is holding steady. And we're anticipating that tomorrow we will be announcing that we are in stage 4.
Yeah, well, wear your mask, folks, get vaccinated.
And then we did have a question from Rebecca Gutierrez. Is there a source of free masks in Travis County?
There is. I saw that, let's see, I think the Latino Healthcare Forum had posted that they are a source of that and people can identify them on Facebook to get them. Dr. Walks, where is it? Jill Ramirez posted it somewhere in here. I saw it earlier. But Dr. Walks, do you have any other thoughts on that?
There are PPE or masks and supplies that APH has for distribution, and I'm also going to go out on a limb here and I remember that there are other sources through our county, but I do not have the details of that. If you want to leave your information in the chat, I'm sure that Kate will get back to you with that information, or want someone from APH will as well.
Okay.
Absolutely, Judge. And the county is partnered with community organizations on PPE distribution, as has Austin Public Health, and we can get some resources that we can post on your Facebook page so that anybody wants it, we can have that up tomorrow.
Okay, great. And it looks like Alice said this weekend at the pop-up vaccine event, they're giving out PPE, and Jill notes that the Austin Latino Coalition, if you contact them by Facebook, have PPE, and then we'll get more information up on the website about that as well. All right, well, we are close to the end of the hour, so I just want to say thank you all so much for being here, and especially to our legislators who are in the thick of it. And despite, frankly, some of y'all having COVID, you're still fighting for us and sticking it out up there all alone in a hotel room. We're thinking of you as you're quarantining up there. Thank you for doing that. Please sign up for our newsletter. Follow us on social media. We're on Instagram, Facebook, and Twitter, all as Travis Co Judge on all those sites. So the arroba at Travis Co Judge. You can also call us anytime, 512-854-9555, and Kim Romero will likely answer the phone. And then you can email us, judge@traviscountytx.gov will get to us as well. And the links are going to be in the chat. And if we can do anything to help, please let us know. And just thank you all so much for being here tonight, for all the help that you've put into helping get people vaccinated over the past several months. It's obviously not over yet. We're still working hard to get the vaccine rates up across the county, and get people to wear masks again, especially when they're indoors. Kate, anything else? Mal?
Nope,
Right.
You got it, boss. Thank you.
All right. Thank you all very much. Have a good evening. We'll talk to you soon. Thank you, Senator and representatives.
Thanks, everyone. Bye.